Good day, ladies and gentlemen, and this is the Insider Zambia. On today's episode, we have the Senior Manager, Corporate Communications from the Zambia Medicines and Medical Supplies Agency, commonly known as ZAMMSA. There has been a lot around this agency, especially in relationship to the Ministry of Health. And we have our manager today to discuss and deliberate on all the ongoing scandals, as some may call them, today. Welcome, Bradley. How are you today?
I'm good. Thank you so much for the invite to come to the Insider podcast. I must make mention that this is actually the first podcast that we've been on as ZAMMSA, so it's quite exciting for us and quite a privilege to appear onto this podcast to explain issues surrounding the Zambia Medicines and Medical Supplies Agency.
All right, perfect. Before we dive in, maybe you can give us a little bit of briefing on your position and ZAMMSA itself. Thank you.
Yeah, so my role at ZAMMSA is basically I'm head of corporate communications, senior manager corporate communications. So my role is basically to manage the reputation of our organization and also ensure that we have constant stakeholder engagement and management. As you may know that we have very critical stakeholders as ZAMMSA in terms of first the general populace, the people that actually receive the medicines, obviously the key stakeholder, and then we do have the other interested parties like the Ministry of Health, the cooperating partners that help to finance ZAMMSA, and also government as a whole, because what we do is on behalf of the government of the Republic of Zambia.
Thank you. That's wonderful. Let's get into it. Since 2020, ZAMMSA has faced a number of scandals. We spoke about them offset as well. This is with regarding to the 62 containers that went missing. This is also regarding to the honeybee defective supplies that we had, as well as the ongoing anti-corruption attorney general deliberations that's happening between yourselves and the organizations mentioned. Obviously, there has been a whirlwind of information that has been spewed into the general public, and we are obviously to take that information, and this is where we're now dissecting it. When it comes down to supplier vetting and understanding your suppliers and the procedure itself around the procurement of these said medicines and products, what is the procedure that goes with that?
So thanks for that, but maybe let me begin with perhaps a precursor that will explain who ZAMMSA is and the mandate of ZAMMSA.
Please.
So you may know that prior to 2019, we had what is known as, or was known as, Medical Stores Limited, MSL. And Medical Stores Limited basically did the storage and distribution of medicines on behalf of the government of the Republic of Zambia to all the public health facilities. Come 2019, ZAMMSA is created through an Act of Parliament, Act number 9 of 2019, which gave MSL an additional mandate of procuring, because they were doing the storage and distribution, and now they're given an additional mandate of actually doing the procurement of the medicines on behalf of the Republic of Zambia. So when that change came into place and the formation of ZAMMSA was realized after that Act of Parliament, it was no longer called Medical Stores. It became known as the Zambia Medicines and Medical Supplies Agency, because now it had an additional mandate of procuring. So the mandate, the key mandate of ZAMMSA is basically in a threefold. Our main functionality is to procure medicines on behalf of the government of the Republic of Zambia through the Ministry of Health. So we buy everything medicine related for all the public health facilities across the country. Now, you may know that we have over 3,500 health facilities in this country. So our job is to buy medicines and medical supplies. So medicines can be anything: essential medicines, antiretroviral drugs, TB medicines, malaria medicines, and then medical supplies can be anything cannulas, syringes, even the disinfectant that is used to actually clean the hospital is supposed to be bought by ZAMMSA. The equipment, the hospital beds, CT scans, all that is supposed to be bought by ZAMMSA on behalf of government for all the public health facilities. The second mandate of ZAMMSA is to store that which we've procured, the medicines and medical supplies. So what we do is what we've bought, we then store it into our main warehouse, which is located in Lusaka. And then we have 7 hubs spread across the country. And the role of the hubs is to play a similar role that the central hub plays, but they are more accessible and to the health facilities, and so the proximity is well suited for those health facilities, the 3,400 facilities, to access them. So what they do is, apart from trans-shipping and trans-docking, they also distribute what we call the last mile distribution process, which is the third function of ZAMMSA, which is distribution. So we are mandated to distribute that which we've bought and that which we've stored to all the 3,500 facilities across the country. It's our responsibility to take the medicines, to take the beds, to take the CT scans to each and every health facility, hospital located in Zambia. As long as it's a government facility, it's our responsibility to take it. So to summarize it, our role is to buy medicines and medical supplies, to store the medicines and medical supplies, and to distribute those medicines and medical supplies to the health facilities across the country. So that gives us a context of how ZAMMSA is built and the core mandate of ZAMMSA. And also I should emphasize that the role of ZAMMSA ends at the point at which we deliver that medicine to that facility. Once we've delivered the medicine to the health facility in Chiengi or Shangombo or Kalomo, once we deliver that medicine there, our role as ZAMMSA ceases. It's now the responsibility of the Ministry of Health to see how that medicine is stored in the health facilities and how it's dispensed to the patient. And at that point, ZAMMSA is no longer involved, because our role is basically just to buy, store, and distribute.
In layman's terms, we're just going to repeat that. You said buy, store, and distribute.
Exactly.
Back to that question I'd initially asked.
Yes.
Yes, the tender process. What is the procedure for your tender process?
Okay, so we are obviously a public institution, and we, in terms of procurement, we are regulated by the ZPPA. So as you may know, there is what is known as EGP. It's an electronic government platform where all tenders are advertised and can be easily accessed by anybody, locally, internationally. So every tender that ZAMMSA is involved in has to go through that process. So that is the regulation. That is the law in this country. You cannot award or advertise the tender anyhow, apart from using EGP. So once you go to the EGP platform, you are able to see the tenders that ZAMMSA has floated, and then you can participate based on the specification documentation that is available and the requirements that are made available on that platform. Of course, because we are in a very sensitive sector where tomorrow we can have an outbreak, we can have cholera tomorrow, we can have COVID tomorrow, we can have any illness that can come into place. So because of that nature, we also do what we call direct bids. And a direct bid, in layman's terms, should signal an emergency. So every time you hear ZAMMSA direct bidding, it means there's an immediate need of that medicine or medical supply in the country. And that is the only reason that you find us direct bidding. So we are allowed to direct bid through ZPPA. And of course, we seek guidance from them, and then we get authorization, and then we direct bid. So once a procurement has been advertised and we have bidders that have responded. What happens next is it goes through an evaluation process where the key elements of the evaluation are obviously pricing. Does it meet the right price? Is it of the right quality? And does the supplier have the capacity to deliver timely? Because remember, we're dealing with medicines and medical supplies. So any delay can lead to fatalities. So we don't want to reach such scenarios. So we want to make sure that there is capacity in the supplier to deliver timely. So once it's subjected to those three, it then goes through the evaluation committee makes a recommendation on who they feel is the best bidder of those that have been responsive. And then it goes to what we call ZPC, ZAMMSA Procurement Committee, which then sits and deliberates and then does the awarding of the contract based on what has been submitted by the evaluation team. And even the direct bids that we make also are subjected to a similar process where when a direct bid is made, it still has to go through the overriding body, which is ZPC, ZAMMSA Procurement Committee, which makes the overall decision as to who gets awarded that contract.
Okay, from your explanation, it seems pretty thorough, but I'm curious to know how a honeybee was selected for that particular tender when they did not even exist. The honeybee was only incorporated, I think, in April of 2020, and yet the tender selection for that particular consignment was done in 2019, October of 2019. So if your process is so thorough, where was the mistake? What happened? Why was a company that was not incorporated given a tender? Was it favoritism? Were people maybe being given more leeway than others? What happened there?
Okay, so you may note that that occurred prior to 2021 and before that, and I must make it very clear that the matter has been reintroduced in court. It's currently an active matter in court, and there's investigations going around how that procurement was arrived at, and possibly even the angles that you've mentioned are now subject to the court's active processes. So it will be very not only criminal for me to comment on it, but my hands are tied and I'm not in the position to actually respond to that. All I can mention is that there is definitely an active case which has been revisited, I think, in the last 2 months or so, and is currently in court.
Well understood. All right. Now, how did standard customs and warehousing procedures, how do they fail, leading to the 61 containers being diverted? Is that because is that the same? Is this case in court as well?
Yeah. So look, there is an investigation, a forensic audit investigation. Report that was made available, and we are aware that the law enforcement agencies, DEC and the police and anti-corruption, are actively involved in the process of investigating what happened. But that is an overall picture. But there is also information which is in public domain, and it's everybody knows that there was 61 containers that were supposed to be received at ZAMMSA, but were not received at ZAMMSA and ended up at a private warehouse in Makeni.
Yes.
So I will speak to what is in the public domain and veer off anything that is under investigation. But what I can say is that, yes, we did have an occurrence where 61 containers that were coming from Egypt, from the United Procurement Authority, UPA, the government of the Republic of Zambia entered an agreement with the government of Egypt, the Arab Republic of Egypt, to procure medicines worth $24 million US. And those medicines were meant to close the gap because if you remember very well, we come from an era where prior to 2022, we were sitting at about 33% availability of medicines in health facilities. So there was a serious shortage of medicines in the country. So one of the interventions that the government considered was to go into a bulk procurement with the government of the Republic of Egypt. And through that agreement, we procured 24 million US dollars worth of drugs, medicines, and medical supplies from Egypt. So we had received quite a number of consignments, and the 61 containers was one of the consignments that we had received. So they were supposed to come directly to ZAMMSA, but for some reason, like I mentioned earlier, which I can't explain because it might interfere with the processes, but for some reason, the containers were diverted to a warehouse, a private warehouse in Makeni. And ZAMMSA was only made aware, I think, after 7 days or so, that these containers were not brought directly to the warehouse. And then after that happened, the Minister of Health personally got involved. It was Honorable Masebo at the time.
Yes.
And she personally got involved. And the next action was she actually reported the entire ZAMMSA management to the police. And immediately after that, the next day, the law enforcement agencies went to the depot in Makeni and verified that all the 61 containers were there. And there was a directive immediately that all the containers are then moved back to ZAMMSA. So what I can report to you, and which is public information, is that we managed to get all the 61 containers back at ZAMMSA, and that all the medicines and medical supplies that were contained in those containers were certified usable and of good quality. There was no issues with them. And because that was done by the Zambia Medicines Regulatory Authority, which is ZAMRA, when they did that, we then distributed those medicines back into the health facilities. So the most important thing for me is that one, the 61 containers were retrieved, brought back to ZAMMSA, and we thank the Zambia National Service for helping us in that process. And they played a very key role in actually transporting the containers back. And then the second thing is that all the medicines that were sitting in those containers were actually certified of good quality and to be used, and therefore they passed the test, the quality test, and then we were allowed to redistribute them to health facilities, and they have been distributed into the health facilities.
That is well and good. And we are glad that, and we're hoping that the gap that you had mentioned initially was also met by the redistribution of those missing but found containers. When you speak of the Ministry of Health, you had touched on Honorable Minister Masebo's part in the entire debacle. The synergy between the Ministry of Health as well as ZAMMSA has been something that has been debated upon. Offset, we had discussed how ideally they can work as independent bodies, but ideally because of the unisons in the fact that you are both under the health umbrella, what is the communication like, and maybe how has the reporting changed since that said scandal? Because as you mentioned, it took about 7 days for ZAMMSA to realize that the 61 containers were missing, and I'm not too sure if the Ministry of Health had found out at the 7 days because she had reported it as soon as she found out. Maybe you can give us a little bit of information on how the communication between the two bodies goes.
I see Namonga is trying to get me fired.
We can have your job.
Yeah, but it's, I think it's a very key observation from your end, and as a result of that, you can see that there was certain repercussions, and I'll get to them. When the Minister of Health did find out, she summoned the entire ZAMMSA management. So all of us were summoned to our office, including the then director, General, who was Mr. Victor Nyasulu, and the entire team. All of us were actually summoned to our office. I remember we were in that office from about 10 in the morning. The moment we left that office, all of us were living in vehicles that drove us directly to Central Police, where all of us had to be questioned and interrogated as regards to what had happened to the containers. So I remember the same night, we actually went to Makeni to actually see the containers. So I remember the last person to leave the police probably left around 03 in the morning, the next day. And the next day, the minister obviously got a more detailed report on what was happening. And the meeting I remember was on a Friday. And the next week, she appeared before the floor of Parliament, and as per jurisdiction, she had to mention to Parliament what had happened. So she issued a statement to Parliament that 61 containers had been diverted, and she gave more details to what had occurred. And I think that was around Tuesday, Wednesday in Parliament the next week. And then after that happened, a process began whereas the board was brought into question and also asked to be answerable. And then within that process, what we saw was that after a couple of months, I think a month or two, the Minister of Health, then Honorable Masebo, was transferred to a different ministry, Ministry of Lands, and then we saw Dr. Elijah Muchima transferred from Ministry of Lands, brought to Ministry of Health. And when he came, one of the first things he did in September was to dissolve the board. And what was made public then was, because of what had transpired with the 61 containers, the board should have been held accountable and should have had you can't just hold management accountable. The board was also held accountable.
Because
and
they
therefore,
approve certain
exactly.
things. Yes.
So the board was dissolved. But even before the board was dissolved, I think a month after the 61 containers diversion, what happened was that the Director General of ZAMMSA was immediately put on suspension and then subsequently dismissed. And then we also had two directors, Director Supply Planning and Director Procurement, who were also relieved of their duties. And then eventually we had three more directors, Director Finance, and then we had Director Human Resource, and we had Director Warehousing and Distribution, who were also put on forced leave. So you can see that as a result of that, a lot of things have fallen into place and a lot of investigations have occurred. But also, maybe before I answer the communication aspect, is also to mention that after the Minister of Health announced to the country that the containers had been diverted and what action the Ministry of Health had taken, what the President did almost immediately, I think that happened within 7 days or so, immediately he announced the constitution of a forensic audit. Now take this, because I've seen a lot of people misconstrue this and alluded that to something else. This happened immediately, I think 7 days after the 61 containers debacle. Immediately the President announced that he was commissioning a forensic audit, and it was going to be run by a private institution, which is PwC. Take note of the words, forensic audit, private institution. So what the President wanted, and this is public information, it's in the public domain, the whole idea was that he felt there was more than what met the eye. There was more than just 61 containers
There was more to the
disappearing.
story.
So the whole reason behind it was obviously to unearth any
Other.
issues that could not be correct in the mandate of ZAMMSA, or were making it difficult for ZAMMSA to actually carry out a mandate of procurement, storage, and distribution. So that's how that forensic audit was actually commissioned. After that, we'll come back to it later. Issues of communication, when we had Honorable Masevo, she had constant touch and relations with top management and the board. There was a lot of meetings. I remember we would go to our office almost on a weekly basis, reporting. She wanted to know everything that we're doing, everything we're doing, she wanted to know. And she would always question us. Every major procurement we're doing, every major decision that we're making, she wanted to get to the bottom of it, and she would always question us. I remember we would spend a lot of time in our office as senior management at ZAMMSA. And for some reason, the 61 containers must have somewhat seeped through, because immediately she found out. That's what happened. I've explained how she quickly
Reacted to the situation.
All of us. Immediately she found out. But of course, after the board was dissolved, what the law states is that in the absence of the board, the Minister of Health becomes the board. So from the time that the board was dissolved in September last year, we have been reporting directly to the Minister of Health, who is now the board.
Does ZAMMSA currently not have a board?
We do not have a board from the time the board was dissolved.
Okay.
So we report directly to the minister, and he's the one that gives oversight in terms of functions of the board. Coming back to the forensic audit report, we remember that after that was commissioned, PwC had a meeting last year at State House, where they presented a pre-audit report to the president and cooperating partners. And as you may know, what I didn't mention when I was talking about the mandate of ZAMMSA is how do we buy our medicines? Who gives us the money to buy the medicines? So the way what we call the Medicines and Medical Supplies Fund, or what is commonly known as the drug fund, works, is that government, for instance, I'll speak to this year, government will give us an allocation of 4.9 billion kwacha in the budget to buy medicines. And then we have cooperating partners, the UNFPA, the Global Fund, USAID, then, and other cooperating partners that come and also help us to buy medicines by donating monies to buy that medicine. So the ideal situation in our country is that we need about 16 billion kwacha to be sitting comfortably in order to have enough medicines in the facilities. However, because we are clearly not a very rich country, we're not a rich country, okay? We are still a third world country. So because of that, our budget is constrained, and we are sitting at a budget of 4.9 billion kwacha. And I must give credence to the government, because in 2021, we were sitting at a budget of 1.5 billion kwacha. In 2022, the budget was increased from 1.5 billion to 2.6 billion kwacha. In 2023, it was increased to 3.6 billion kwacha. In 2024, it was increased to 4.6 billion kwacha. And currently, as we speak, we are sitting at 4.9 billion kwacha in terms of what the government has allocated towards the provision of medicines and medical supplies in this country. So it's been increasing, but it's not enough. So what the cooperating partners have done is, we know that we need about 16 billion, is they've also tried to cushion the gap. And they've been supporting us to about another extra 5 billion kwacha of medicines. And how it used to work previously is that we had a basket where everyone puts money in that basket, and then Ministry of Health buys. But because of previous issues, and then it moved to ZAMMSA, the way it works now is that government just allocates a budget, and then through the treasury, the money is given to ZAMMSA to buy the medicines and medical supplies, the 4.9 billion. But the cooperating partners also have their own way of procuring. They do understand that this is what you need to buy, and then they will buy that which we need to buy for that value of which they've donated. And then it's not the actual money they give us, but they actually bring the drugs with that amount of money. So, so because of that, so we sit at about 11 billion worth of drugs supply in this country. So in 2020, last year in December, we had an issue where the cooperating partners, I think, met the president, and they were raising an issue about pilferage and private pharmacies sitting with medicines that belong to government. And this is where the president mentioned and said, look, we've constituted a forensic audit. And this is a pre-audit, and this pre-audit has shown indications of pilferage in certain sectors. And therefore, we will wait for the full audit to come out. So what has happened now is that we've received the full audit from PwC, and when I say we, I mean the country, because it was commissioned by the president. Okay, so the president was officially given the audit report, and after he received the report, he gave it to the Auditor General's office, who, after reviewing it, made a public statement and said they were now giving the report to the law enforcement agencies for prosecution. And also, they made a second note where they mentioned that they would also issue it to the Ministry of Health for institutional reforms. So, forensic audit. So, just by mention of the word forensic means it's not your normal audit, like every other audit that we carry out. So, meaning it cannot follow the normal processes of the other audits which are just made public. So, because there's prosecution involved, you do not want to alert those that you're investigating. So, before it's made public, it then goes to the law enforcement agencies. And this is why I have not seen that report, because I work for ZAMMSA. And as far as I know, all of us that work for ZAMMSA could be investigated. So I should not see that report until the law enforcement agencies are satisfied that they've commenced all their operations, investigations, and then it goes to Parliament, and then from Parliament it's made public. So I think what we saw, because we can't run away from this, we saw a lot of media headlines, I think, in the past 2 weeks or so, where every day there was something about what the report is saying. For me, what I felt was we should have not viewed that as an investigative piece, because it wasn't. That was that was a news organization going into a classified document, picking elements and publicizing them. And of course, we can't talk about the repercussions of that, but the truth of the matter is it was just picking up from work which had already been instituted from the government through the president, and they got hold of that report. So it will be interesting to see what is in that report, which I unfortunately cannot speak to because I have not seen that report, and I'm not aware of the content that is in that report. But the most consoling things for the general populace is that the law enforcement agencies are actively pursuing the issues that have been raised in that report, because we are constantly being, when I say we, I mean ZAMMSA, members of staff are constantly being investigated, interrogated, called to DEC offices, or them coming to ZAMMSA to come and investigate our processes, review the processes. And we know that there's a lot of things going on because even suppliers are getting summoned, and a lot of other people are getting summoned at the DEC offices in relation to the forensic audit that was carried out by PwC. So the consolation is that this has been active, even before the headlines. It's been very active. We know that 3 senior members of staff at ZAMMSA, the Director General, Director Supply Planning, and Director Procurement, were actually charged at DEC offices and arrested concerning the report. And we know that there's a number of our senior members of staff and even junior members of staff that are currently going to DEC, not once, not twice, not thrice, but constantly going there because they're summoning you, they're investigating. So the consolation and the gratification on my end comes in to know that this is an active matter and there's serious attention attached to the investigation.
Okay,
Yeah.
which leads to my next question. What criteria was used to suspend and eventually remove the DG before investigations were done? Why wasn't the whole of ZAMMSA let go and fired like they did him? And you say the junior staff still being summoned and questioned and investigated. Why isn't the DG in office now being summoned and questioned the same way everyone is still there?
So the if I remember correctly, the DG was not dismissed because of issues relating to the forensic audit report, but if I remember correctly, it was an issue of gross negligence. It was an issue of the 61 containers being diverted from ZAMMSA, and that was a serious issue. And I remember very well that was a major issue around it, that he had to take the fall because he was head of the organization. And to have 61 containers of medicines diverted from a facility without knowledge for a certain period was a very, very grave offense. And therefore, they found it imperative that an action of dismissal is taken. And that was the issue. So if you look at the charges that DEC gave him, they're very different because that's an administrative issue. Gross negligence, administrative. But the issues that the DEC charged him with are also different issues in nature.
Okay.
You had mentioned, obviously, being very close with Honorable Masebo during her time at the Ministry of Health when it came down to the communication between the two bodies itself. Ideally, you also did discuss her move from Ministry of Health to Ministry of Lands and Honorable Elijah coming to Ministry of Health now. How has been the relationship with the new minister, and how has this change ideally, and maybe even this new light that has obviously come upon the bodies? Ideally, we know ZAMMSA has always been under the magnifying glass, but obviously with the 61 containers, there was a whole new light that was shed over. How has Honorable Elijah coming on board, being the fact that he's the entire ZAMMSA board as well, how has that adjustment, I would believe, been for the team?
Look, I need to be very honest.
Yes, please.
It's been, to be candid, it's been a very difficult journey for ZAMMSA because just from the figures I was giving you, we've not had a board from September last year.
Yes.
We've got about 7 directors. Out of all those directors, I think we only have 2 that are remaining. The others were either relieved of their duties, and the others are either on forced leave or some form of suspension or something like that, meaning we only have 2 substantive directors.
Currently.
We've not had a substantive director general from the time former DG Nyasulu was relieved of his duties. Most of the directors most of the positions that we have now, almost 70 to 80%, are acting, because even the current director general is acting.
Yes.
So we have a team that is acting. So of course, it comes with its own pressure and challenges, and of course, it's not been easy to run with a team that is mostly acting. The new minister, well, I can't call him new anymore, but the Honorable
current, yes.
Dr. NHIMA has had a very consultative process with us as well. We report to him, like I mentioned. He's come to ZAMMSA several times. We are always asked to go to the Ministry of Health to also give reports on what is going on, because he is the board, and I know that he's been very keen in ensuring that processes are streamlined and we meet our core mandate. So we have a lot of interactive sessions with the minister through the office of the DG and other offices like the PSs as well. We have access to them, and there's been that process. So of course we're not at optimum level, because of course, if you have a lot of people acting, then you're not fully functional.
Yes.
So that has had an effect on our performance in terms of administrative performance. But the good part about it is that we have managed, as ZAMMSA, as I speak to you, we have managed to reach the 70% threshold of availability of medicines at central warehouse level. Regardless of all these challenges that we have, administrative challenges, we have managed to ensure that because of that availability of medicines at central warehouse level sitting at 70%, we've seen a ripple effect where the health facilities are sitting, for instance, let me start with the primary health care facilities, because remember, the health system is structured in tiers, okay, according to the functionalities of that facility. So the first and the basic one is what is known as health posts or health centers. So and that's the primary healthcare. So the primary healthcare sector is currently sitting at 92% availability of medicines, unprecedented in this country. Because we are sitting at 70% at central warehouse on our national reserves, the impact has been that the primary healthcare is sitting at 92% availability of medicines. And what this means is that there's no shortages of medicines in Lealui, in Chelenge, in all these small areas the rural areas where we have these small health posts.
Those reports that come out from those small pharmacies, I remember the minister definitely tackling them a few years ago, but the reports are still there. Are you
I'll
still
come
standing
to that.
on
I'll
that?
come. Please remind me. Let me just delve into
problem.
this, and
Please
then
go
please
ahead.
remind me. Take note of that. So we are sitting at 92%. Now, of course, I don't expect to see a lot of pharmacies in Shangombo. Those are remote areas. In Chulubi Island, those are remote areas. What we've done is that we've ensured that at least at that level, because that is the first point of contact when that woman is pregnant, when somebody has malaria, when somebody has TB, when somebody has an infection, the first place they go to is a health post. So what we've done is we've ensured that through our scheduled supply process, we visit the health post every second month of the year through our scheduled distribution process. We take medicines there. On top of that, we've done something which has transformed the health sector, and this is ensuring that we distribute health center kits to these facilities every second month of the year. Now, a health center kit is a box, a very big box that has 57 to 60 commodities of medicines and medical supplies that speak to the most prevalent illnesses at that level. So remember, I mentioned issues. What are the most pressing issues in our country? We have issues of malaria. We've got issues of pregnancies. We've got issues of injuries. All those small things, antibiotics, diarrhea. All those things that are affected. That kit speaks to those challenges, and one kit covers 1,000 people. So, and our projection is that every health center kit will last for 1 month. So let's say a health post, and remember these are minute, these are very small facilities, has probably 20 people that go there, 10 people that go there, 15 people, 30 people that go there. Because remember, there are over 3,400 health posts. So you find that if it's got 6,000 people that go there, we take 6 health center kits there every 2 months. We have not failed to do that as ZAMMSA in the last 2 years. So as a result, we have significant amounts of medicines sitting at this primary healthcare level. And this is the backbone of the health system. Once you resolve this, it means you've reduced the referrals to secondary facilities, the bigger hospitals. These are the district hospitals. The district hospitals are sitting at 75% availability of medicines. Okay? Then we go to the next one, the tertiary facilities. And these are the teaching hospitals. So these ones are sitting at an availability of 74%. And then we go obviously to the bigger facilities, the specialized hospitals. And these are renal, eye specialist hospitals, and cancer disease hospitals. And this is where now we are sitting at 57% availability of medicines. You might think it's less than the 70%, but if you look at where we come from as a country, where we were actually sitting at 33% availability, this is a huge surge. This is a huge jump. But as ZAMMSA, we're not going to be complacent and say we are fine. So what we've done is to ensure that that 57% increases. What we've done is that we've gone into long-term framework contracts with suppliers to ensure that there's continuance in terms of supplies and there's no break. We don't have to advertise now and then to ensure that. So we want to ensure that the cancer disease hospital, the renal facilities and eye hospitals also sit above the 70% threshold in terms of availability of medicines. I come back to the issue of prescriptions. Okay. So I think there is a myth in this country that a prescription is actually a bad document. I think everyone who gets a prescription thinks I should not get a prescription. That's what I get from the ground. But remember, and what everyone needs to know is a prescription is a legal document that should be given to every patient when a doctor has recommended that they get medicines. So you get a prescription, it's going to have 4 medicines that you need to get from the pharmacy. So there's nothing wrong with you getting a prescription. However, there's everything wrong when you get a prescription and you go to the counter at the pharmacy and the medicine which is available in the facility or the medicine that ZAMMSA has taken to the facility, then you are told, go and buy this medicine from a private pharmacy. There's everything wrong there because the intention of ZAMMSA is to ensure that the general populace gets medicines for free from public health facilities. And you should not pay for it. Government is spending so much money, so there should be no reason for you to be sent away from the hospital pharmacy to go and buy from a private pharmacy medicine which ZAMMSA has bought or ZAMMSA has distributed to the facility. So because of the figures I was giving you, the conversation has tilted. At some point, when we were at 33%, the facilities were complaining, health workers were complaining. Their complaint was ZAMMSA is not bringing medicines to hospitals. This has changed. We are distributing, like I mentioned to you, every month to the big facilities. We take medicines there. Every second month of the year, we take medicines to the smaller facilities. And on top of that, we are taking health center kits to the smaller facilities. This is why we are sitting at 71% as ZAMMSA. Okay? And of course, the trickle-down effect has been the increase in the facilities. Now, the conversation now has changed. It's not about ZAMMSA bringing the medicine. It's about access to that medicine that is sitting in that facility. What we are hearing is people saying, look, ZAMMSA says they've delivered, for argument's sake, paracetamol, but I'm not getting it. I've been told to go buy this drug at a private health facilities. And I must admit that is a reality because just yesterday, I got somebody calling me from a facility in Livingston and telling me, look, Bradley, you're always telling us there's medicine, but I've been told to buy this. And immediately we got in touch with the provincial health director who got in touch with the district health director, who went to the hospital, who got a picture and sent it back to me and said, Bradley, we have this medicine. So we are going to find out why this person, this pharmacist, decided to tell this patient to go buy this medicine. So it is a reality that there is an element of people being given prescriptions for drugs which are actually in the facility. And what we are doing about it is we are working very, very closely with Smart Zambia and other cooperating partners to ensure that we introduce what is known as an end-to-end visibility track and trace system. What we hope to achieve with this is that we should be able to trace the medicine from the manufacturer when he gives it to the supplier. We should track it and trace it. It's coming. It's on a container, on a ship, on the Red Sea, on this date. It arrives at Dar es Salaam at the board at Dar es Salaam. It's brought into the country. It's driven into Chirundu. We know where it is. When it lands at ZAMMSA, at receiving bay, we even know it has now arrived through a dashboard. We're able to tell within the system that now it's within a ZAMMSA warehouse in Chipata, or it's in Mpika, and now it's on transit on a truck going to a health facility in Mansa. And then we should also track and see that now it has gone into the facility itself. It's sitting in a pharmacy, and now it has been dispersed to Nabonga. And they've given her two of these. And there were 10 taken to this facility. She's remaining with, meaning the facility is remaining with 8. 2 have been given. So the system, we're working on that system so that we're able to track and trace every commodity that we disperse as ZAMMSA. And we believe that will play a very key role in reducing the issues of pilferage of medicines and government medicines finding themselves in private facilities or pharmacies. I can tell you that it's at a very advanced stage of discussion and implementation. So we know that when that is instituted, it will bring out a lot of issues. We hope that that same system will be able to also help us in terms of even whistleblowing.
I was going to bring up whistleblowing. Yes.
When you, so there's so much technology around it. We hope that it will be able to, through your phone, without even internet access, you are able to just take a picture of the medicine you've been given and see that this is stolen medicine or it is government medicine and this is not government medicine.
Yeah.
And then without you doing anything, we hope that a system like that should be able to send an automated message to say such a commodity found in private hands in such a place. And we hope that that process is also managed by independent stakeholders that don't have any attachment to ZAMMSA and are able to prosecute and ensure that they follow through such issues. And we hope that that will reduce the issues of pilferage, because it doesn't make sense to buy so much medicines, take them to facilities, and people do not have access to them. So those are some of the challenges that we have. But for me, what excites me is that, of course, it's a gradual process to complete the whole exercise of buying, storing, and delivering to the facility and ensuring that the patient actually gets the medicine. I think we've done the 3. The only part that is remaining is now the full access of the medicines. And we believe that through that end-to-end track and trace visibility system, we should be able to close that gap and ensure that Zambians are now benefiting from the 4.9 billion that government is allocating towards the purchase of medicines.
Okay, so talking about whistleblowing, which I was thinking about, what protections have you put in place for staff to easily report any mishaps? Like, I could be working in the pharmacy with Nawonga. Nawonga's telling the patients to go and buy their medicines from outside because Nawonga wants to pocket the medicine. So how am I protected?
So coincidentally, and I happen to be the chairperson of the Integrity Committee at ZAMMSA.
Okay.
So our role is obviously to formulate the whistleblower policy. We already have a draft which is sitting with with the relevant authorities, and once that is approved and everything, we'll implement. And already we're looking at a lot of other measures. For instance, a toll-free line where we are able to get information, and people can call us and bring out any issues they feel are related to pilferage or anything that defeats the mandate of ZAMMSA. Also, we have anonymous processes within ZAMMSA where we ensure that people can report issues of any anomalies, and it is happening where we see anomalies, and anonymously somebody will bring out information. Either they'll write to us anonymously. We got all those suggestion box and all those processes within ZAMMSA. And then for the facilities also, like I've mentioned to you, just yesterday I got a call, and that happens a lot. I get people calling me, or they'll call somebody who will bring that information to us as integrity committee and tell us there's this issue. And then we have the privilege of actually escalating issues directly to the law enforcement agencies. So sometimes when it's a criminal matter, we actually escalate it to that degree. But of course, I think until we get fully operational with our whistleblower policy, we still have a bit of challenges, but we are getting there.
Okay. How are you working with the Ministry of Finance to recover misspent monies?
Okay, so I don't really get your question.
Are you doing any? Are you working with the Ministry of Finance to recover any?
Look, what I must make mention is that without Ministry of Finance, we are literally we can't do anything at ZAMMSA, because they are the treasury, and they appropriate the funds to us. And so previously, what used to happen is, I think 2022, we had the way the law worked was that you could only spend you could only pay for what, I mean, we could, at ZAMMSA, we have a budget, let's say 4.9 billion.
Yes.
So you have 4.9 billion. It means we could only spend
what has been budgeted.
What not really what has been budgeted for. We could only commit, and by committing, so the way it works with ZAMMSA is that we have a supply planning department, and the role they play is to ensure that we have a pipeline, an effective pipeline system that does the forecasting and quantification process, ensuring that we've planned what medicines we need at every different level of the year. So they plan ahead. And once supply planning does that, it triggers or initiates a procurement process for procurement. So procurement will only buy that which supply planning has forecasted and quantified. So once procurement gets that, they then make the bid, advertise the bid, and then they award the bid. That's commitment. So once we commit, it's a value. So if the value is 1 billion or 4.9 billion, it means we've committed 1 billion already. So previously, the way it was working, we would work based on what we are given. So if the Ministry of Finance gives us 1 billion, then we buy based on what. That's how the law was. Okay. We were not allowed to spend, even if we have a 4.9 billion, we were not allowed to buy more than what we are given. But when ZAMMSA started, we had issues with procurement. I think we had a slow burnout rate in terms of procuring against that which we've been given. So we were given money. For instance, we were given 1 billion, and we would take a long time to burn out that 1 billion. And sometimes, I know there's a year we didn't exhaust the full budget, and you know how the Ministry of Finance works. At the end of the year, the money is swept and taken back to the ministry, to the treasury account. So you lose that money, but you've committed. But then the law changed along the way. Now we are allowed to commit even before they give us money.
Okay.
So the procurement department was obviously enhanced, and we've been committing to the budget entirety. So the challenge, of course, like I said, we are not a very rich country, and we don't have money sitting. Money has got no color that this is ZAMMSA, this is Ministry of Defense. The government just has money sitting there. So when you ask for it, they give it to you. So there are times when we need it, and you find that maybe the government doesn't have that money at that time. So those are some of the challenges that we face. Is we've committed more than what is being appropriated.
Okay.
Yeah.
All right. Before we end the show, what are ZAMMSA's top 3 priorities for 2026 to ensure corruption-free access to medicines?
So like I mentioned, the game changer for us will obviously be
The tracking
The
system.
tracking
exactly
system.
the end-to-end track and trace visibility digital system. I think that will be a major game changer. And also we've seen that this year, before the interview, I was joking with Nawonga. I was asking her to just tell me 3 scandals that ZAMMSA has done this year, and obviously you can see that despite the negative press, it's not by luck that we are sitting at 70%, 71% availability of medicines at ZAMMSA. There is a lot of work taking place. We've done 2 years ago, we were doing 250,000 loads. That's visitations of facilities. As we speak now, we are doing over 550,000 visitations or loads to facilities. There's a lot of work that ZAMMSA is doing. So we are still committing ourselves to ensuring that we have improved health access to all the facilities and do not break the chain of distribution in ensuring that every month we visit the smaller health facilities, the bigger health facilities, and then every second month we visit the smaller facilities and maintain the level of availability at not less than 70% at central warehouse. Why we're saying that is there's never a situation where you will have 100% availability of medicines anywhere in the world. There's nowhere where you'll find that. But our goal is obviously to meet the WHO recommended status and standard of 70%. And of course, improve in terms of efficiency levels, transparency, and less corruption as well. Those are the issues that obviously we will work towards.
Okay.
Amazing stuff. You heard it here first, ladies and gentlemen, on The Insider with our very own ZAMMSA representative. We're hoping for a more scandalous 2026 ahead. Thank you so much.
Thank you for joining us today. Thank you, Bradley, for your time. This has been The Insider, telling the untold.